Hello, welcome to the Menopause Is It Hot in Here presentation. My name is Pamela Kvich, and I am the Senior Health Promotion Specialist at SummaCare, and I will be your host. During this presentation, I will define menopause, review statistics, identify the stages and common symptoms, review effective treatments and practices to manage the condition to improve well-being. In addition, provide tips on how to support and manage menopause in a work environment. Here are the 8 dimensions of wellness. While all dimensions of wellness need our attention, there doesn't have to be balance among all of the dimensions at a given time. Instead, the goal is to find harmony with the dimensions that are most authentic to you in the moment. This presentation will review the following dimensions. Physical, by adopting healthy habits and avoiding or minimizing risky behaviors. Emotional and mental, focuses on understanding ourselves, coping with the challenges life can bring, and have the ability to experience and cope with our feelings. And last, social, encouraging us to take an active part in improving our communities, connecting with others, establishing supportive social networks, developing meaningful relationships, and creating both safe and inclusive spaces. Menopause occurs when a female's menstrual periods stop permanently for at least 12 months, noting the permanent end of fertility. As a female ages, the number of eggs in the ovaries decreases, and the ovaries reduce the hormones to prepare for a pregnancy. The date of a female's final menstrual period is the start date of menopause. If, however, both ovaries are removed before menstrual periods have stopped, the date of surgery is the start date of menopause. Perimenopause begins when the time from one period to the next varies by at least 7 days. This menopausal transition is the time leading up to menopause in which menopausal symptoms may occur and periods become less regular and are spaced farther apart until the final period. Menopause can vary from 45 to 55 years of age or older, and on average, females in the U.S. start to experience menopause around the age 51 or 52, depending on the research. Let's review some statistics and facts. Research has shown that on average, women reach menopause between the ages of 45 and 55, with most symptoms starting at age 41. 10% will reach menopause before the age of 45, and 1% enter before the age of 40. Women represent roughly half the U.S. workforce, and approximately 45% of those are in perimenopause or menopause. That is 50 million women in the U.S. currently navigating menopause, with 2 million females reaching menopause each year. Up to 80% will experience hot flashes or night sweats. A few women will have very disruptive hot flashes, with 10% of women having more than 7 hot flashes per day. Unfortunately, frequent hot flashes can last up to 7 or more years for about half of the women experiencing them. About 2/3 report memory complaints such as forgetfulness during the menopause transition. About half report sleep problems during perimenopause, compared to 30% in premenopause. During the menopausal transition, women tend to gain fat mass and lose lean muscle mass. Women are at higher risk for sleep apnea, which may be related to hormonal changes and weight gain. And last, vaginal dryness and pain with intercourse increases from about 15% in premenopausal women to about 3 times that in late perimenopause and postmenopause. Throughout their lives, women pass through numerous bumpy times of hormonal shifts, starting from puberty through to the years following menopause. Those significant changes they experience are divided into distinct stages, each with its own significance, symptoms, and challenges. Knowing how to differentiate between them can help women to maintain their health and prevent complications ahead of time. Let's start with the turbulent perimenopause stage, which, adding to the confusion, is very commonly referred to as menopause. Perimenopause starts with the first hallmark menopause symptoms and ends when a woman finally reaches menopause. During perimenopause, the ovaries start running out of eggs, leading to intense hormonal fluctuations, which may cause a multitude of unpleasant symptoms. Next is menopause, the date when a female has not had a period for 12 consecutive months, marking the end of reproduction. At this point, many of the symptoms that plagued a female throughout perimenopause have lessened or disappeared. Some, however, may continue for several years. Once a female is confirmed to have reached menopause, she enters the final menopausal stage of postmenopause. This starts the day after the confirmed menopause date. During this time, primary hormone production is halted. However, the hormones are still produced in small amounts in other parts of the body and consistent low levels. These hormonal lows bring about a set of new health challenges, most important of which being osteoporosis and heart disease. It is also common for women to still experience some lingering symptoms for a few years into postmenopause. Late onset menopause. It is not uncommon for a woman to have a long reproductive life and enter menopause later than the average age of 51. In fact, it is estimated that between 2 to 5% of women experience late onset menopause, which is defined as occurring after the age of 55. While there is no set latest age, the majority of these women will become postmenopausal by their early 60s. On a positive note, late onset menopause has been linked to a number of health benefits, including a lower risk of cardiovascular disease and lower overall mortality. Surgical menopause means that a female's fertility ended as a consequence of removing both ovaries. Women may have their ovaries removed to treat a condition they already have or prevent a serious condition from developing. Because menopause is induced by removing the ovaries, which are the main estrogen producers, sudden and severe symptoms may occur. Long-term estrogen lows put women at higher risk for certain health conditions as listed here. Fortunately, both symptoms and health risks can be reduced through healthy lifestyle practices, herbal supplements, and medications. Always talk with your healthcare provider before taking any herb or supplement. It is unknown whether certain herbs or natural products are safe to treat menopausal symptoms. Estrogen levels rise and fall throughout a woman's life, and there are 3 stages of a woman's health that are most commonly identified, and they are menses, start of a menstrual cycle as an adolescent, celebrating a pregnancy if a desired pregnancy occurs, and last, menopause, the end of a menstrual cycle. Aside from the ovaries, estrogen is also produced in adipose tissue and adrenal glands, as well as in the placenta during a pregnancy. Aside from its principal reproductive role, estrogen carries out a range of other tasks that include protecting against heart disease, preserving bone density, sustaining mood levels, and preserving skin tension. Let's focus on estrogen imbalance specifically. This is a surprisingly common issue among women of different ages, presenting with a wide variety of symptoms such as irregular periods, hair loss, headaches, and mood swings. Having too much estrogen can be due to periods of reproductive significance such as pregnancy, as well as lifestyle factors being poor diet and stress. They can also be caused by medical treatments, medications, and environmental exposures. Because levels of estrogen fluctuate on a daily basis, current estrogen levels are widely based on age, current stage of the menstrual cycle, and external factors. Causes of high estrogen levels include both pregnancy and menopause, and the absence of ovulation leads to a drop in progesterone production, which can lead to high estrogen levels as it goes unopposed. In addition, stress, poor diet with low fiber to remove estrogen, smoking, alcohol, and caffeine may be factors. Induced causes would be hormone replacement therapy such as birth control or menopausal therapy, environmental pollutants, insulin resistance, or poor liver function. A sudden influx in estrogen levels may lead to short-term symptoms like cramps, fatigue, and headaches. During postmenopause, excessive estrogen levels manifest through symptoms such as hot flashes, weight gain, memory lapses, and irregular menstrual periods, among others. Causes of low estrogen levels include childbirth, breastfeeding, and menopause. During this decline, low estrogen may cause a host of symptoms women experience, such as migraines, irritability, decreased libido, and more. Effects of low estrogen levels may lead to recurring urinary tract infections, vaginal irritation, hair loss, and further symptoms. Low estrogen may also cause no ovulation, interfering with conception, or an imbalance can cause a miscarriage if the egg doesn't attach properly. If left untreated, low estrogen levels can lead to more serious health conditions. Therefore, preventive screenings are beneficial to uncover issues that may arise. Progesterone is a hormone produced in the ovaries to foster healthy menstruation and by the placenta to prepare for and maintain a pregnancy. This graph depicts the fluctuations of progesterone, the hormone that helps to keep estrogen in balance. The range of tasks that progesterone performs in the body include promotes overall wellness of the reproductive tract, curbs contractions during a pregnancy to prevent preterm labor, produces calming effects in the brain, helps to retain bone density, supports cardiovascular health, modulates the immune system's activity, and assists in liver and kidney functions. This graph demonstrates how progesterone works in tandem with estrogen to regulate the fertility process to ensure a healthy conception and pregnancy. Knowledge is power, and being familiar with the most common symptoms is important. Keep in mind that menopause affects everyone differently, and as a result, the range and severity of symptoms vary for each person going through perimenopause. No one's journey will be the same. There are a lot of symptoms that I will be scrolling through, and remember, we are all unique, and these are common symptoms that you may or may not experience. I am sure I may identify some that you may not have been aware of. Let's review them. The most commonly known and reported symptom, with 75% of women suffering, hot flashes, are caused by hormone levels restricting our body's ability to regulate temperature. The second most reported issue, night sweats, are a result of hot flashes during the night. Cold flashes may start in perimenopause and continue through menopause. The hypothalamus, the part of your brain responsible for your body's thermostat, can misfire as estrogen levels drop. Your hypothalamus tells your body that it's overheating when it's not and can suddenly signal to you that you're freezing. Women disproportionately suffer with insomnia, and this can get worse during menopause. A few tips: avoid caffeinated drinks after lunchtime, try to do gentle daily exercise, and consider a standard bedtime routine. Feeling flat and down? It's extremely common to feel tired and fatigued as your hormone levels change. A few tips: exercise early in the day to try to boost energy, head to bed early, and try to make sure your diet contains B vitamins. When hormones fluctuate, your body isn't able to regulate its cellular energy, which can lead to a lack of motivation. Sometimes called meno-rage, mood swings can have women feeling a huge amount of guilt. But remember, it is driven by our hormones. It's like being a teenager in reverse. Around 7 in 10 women say irritability is their main emotional symptom due to the drop in estrogen levels. 23% of women suffer increased anxiety and stress during menopause, and it can be debilitating. Don't think it's just your mental health, though. Seek help if needed. Migraines can be crippling in menopause as hormone headaches are very real. Stay hydrated and take time away from stressful situations when you need to. Estrogen in particular encourages blood flow to the brain. So if there's not enough of it, it's unlikely you'll be able to concentrate well. Along with concentration, brain fog impacts our ability to remember key components. A few tips: stay well hydrated and aim for a good night's rest, but reach out for help if it's a problem. Lapses in memory are generally common with age, and hormonal changes during menopause can cause us to sometimes be more forgetful, and the research has shown this to be true. Menopausal changes can lead to depression. A few tips: mild exercise and a healthy diet can help. However, seek professional help if your depression is prolonged and severe. Anxiety can be overwhelming and develop into panic disorders. Hormones work together to regulate mood, and as they drop off and fluctuate, women can be more at risk. Bloating due to water retention is caused by the hormone changes, leading to our bodies to store more water in our extremities. A few tips: reduce salt in your diet and try to reduce stress. It could be hard to lose weight gained in your 40s and 50s due to the changes in hormone balance. Note: muscle will be lost and fat gained without proper diet and exercise. Be kind to yourself. Your weight does not dictate your worth. Changing hormones could lead to sore and tender breasts. Due to hormonal changes, milk glands shut down and this tissue is replaced by fat, leading to a possible increase in breast size. When estrogen levels drop dramatically, this causes your body to shrink tissues in your breasts. This change, combined with depleting collagen production due to the aging process, can cause your breasts to sag. Due to a lack of estrogen, vaginal dryness may occur. Lubricants can help. Seek help from your healthcare provider if needed. Lower estrogen could lead to a lower sex drive. Periods can be irregular and often heavier or lighter. This is due to the hormones that regulate the menstrual cycle fluctuating. Low estrogen is responsible for regular trips to the bathroom. A loss of bladder control or weakness is called incontinence. You may have a sudden urge to urinate, or urine may leak during exercise, sneezing, or laughing. This is not uncommon, and you shouldn't be ashamed. Hormonal changes can thin the lining of the urethra. That is the tube that takes urine from the bladder out of your body, making you more prone to urinary tract infections. If you are experiencing UTIs, talk with your healthcare provider about medications, exercises, and other strategies that may help. Feelings of nausea may be due to lower levels of progesterone, causing gastrointestinal problems like bloating, heartburn, and indigestion. You may experience the sensation of small electric shocks on your skin, as though you have had a static charge from rubbing a balloon on your head. This is due to the fluctuation of estrogen. In addition, it's estimated that a quarter of women in their 40s and 15% of women aged 50 or older suffer from acne. So just like during puberty, hormonal fluctuations are mainly to blame. Studies show that women's skin loses about 30% of its collagen during the first 5 years of menopause. After that, the decline is more gradual, with a 2% decrease per year for the next 20 years. This will result in your skin's texture becoming both thinner and drier, and you may notice more lines and less firmness in your skin around your jawline, cheeks, and neck. Also, itchy skin is caused by declining collagen levels due to reducing estrogen. Seek the advice of a dermatologist if you need help. Our nails start to become brittle and lose luster and strength. A hormonal decline can cause our hair follicles to loosen, leading to thinning hair. A dry mouth can alter your sense of taste, appetite, and cause burning mouth syndrome, which is a lesser known but awful side effect. It can also cause you to have a sore throat and lips, leaving you feeling more thirsty than usual and making you hoarse. It is important to stay hydrated and use lip balm to avoid lip soreness. Dizziness may be a result of hormones unbalancing our blood sugar levels. This fluctuation can affect our body's response to insulin. Breathing difficulties can be a result of the drop in estrogen, causing an inflammation response in the body, which could interfere with lung function. However, anxiety may also prompt shortness of breath. Your body may surprise you with irregular heartbeats and palpitations alongside anxiety and heightened stress. Estrogen affects your cartilage, which is the connective tissue in joints. Fluctuating hormones cause our joints to hold less water, which they need to work properly, which will then result in inflammation, stiffness, and joint pain. Muscle tension is impacted by both hormones. Progesterone has a calming effect, so when it dips, everything gets tenser. When the estrogen level drops, cortisol levels can rise, which results in higher levels of stress and can also raise blood pressure and blood sugar. Please consult your healthcare provider so that they can support you if you have any of these symptoms that are severe. While there may not be one miracle cure, you don't need to suffer unnecessarily. So how do we take charge of those hot flashes? Here are some tips to help you avoid them. Dress in layers. Choose loose cotton clothing. Carry a portable fan if you can. Avoid alcohol, spicy foods, and caffeine. Reducing caffeine and alcohol is recommended to ease hot flashes because high alcohol and caffeine consumption has been shown to worsen them. If you smoke, please try to quit. Try to maintain a healthy weight as best you can and explore mind-body practices to help you reduce stress. So how do you take charge of your sleep routine and schedule? Follow a regular sleep schedule. Go to sleep and get up at the same time each day. Avoid napping in the late afternoon or evening if you can, as this late napping may keep you awake at night. Exercise at regular times each day, but not close to bedtime. Avoid eating large meals. Stay away from caffeine found in coffees, teas, chocolate, colas late in the day. And remember, alcohol won't help you sleep, and small amounts may make it harder for you to stay asleep. Try to develop a bedtime routine. Some people read a book, listen to soothing music, or soak in a warm bath. Try to keep your bedroom at a comfortable temperature, not too hot or too cold. You may want to consider a cooler temperature during the evening or night, and work really hard to have a quiet environment. Try not to watch television or use your computer or mobile device in the bedroom, even if they offer blue light protection. The light from these devices may make it difficult for you to fall asleep by interrupting your natural sleep cycle. Layer your bedding so it can be adjusted as needed. Turn on a fan at a comfortable speed. This may be twofold, 1 for air movement and 2 for white noise. Consider over-the-counter sleep aids or melatonin, which is a daily or a dietary supplement found by most vitamins and supplements. Consult a healthcare provider for guidance over-the-counter sleep aids because most of those products should not be taken long-term. We're not completely sure why the risk for depression increases during the menopause transition, but hormone fluctuations likely play a role. Women who are most at risk are those with a history of depression, but even women who have not been depressed before are about 3 times more likely to develop depression during the menopause transition compared to premenopause. Research shows these treatments may help. So psychological options include antidepressants. Clinical hypnosis may help to decrease the number of hot flashes and night sweats, decrease sleep problems, and decrease both anxiety and depression. Cognitive behavioral therapy may help to improve mood issues, anxiety, and depression. Cognitive behavioral therapy for sleep may help to decrease overall sleep problems and improve anxiety and depression in those with sleep problems. Psychotherapy, talk therapies, and counseling approaches are very helpful for treating depression and anxiety and supporting individuals as they experience challenging times. The physical option is pelvic floor physical therapy or Kegel exercises are the physical options used for both vaginal pain and for urinary incontinence. Kegel exercises for women are designed to strengthen pelvic floor muscles, which support the uterus, bladder, small intestine, and rectum. The easiest way to identify your pelvic muscles is to stop urination midstream. Benefits include improved bladder control and prevention of pelvic floor disorders. After menopause, there are very low levels of estrogen and progesterone that raise your risk for certain health problems. Examples of common health problems in the years after menopause include heart disease. Before age 55, women have a lower risk of heart disease than men. Estrogen helps keep blood vessels relaxed and open and helps the body maintain a healthy balance of good and bad cholesterol. Without estrogen, cholesterol may start building up on artery walls, leading to the heart. Stroke. Your risk doubles every decade after age 55. The lower levels of estrogen in your body may play a role in cholesterol buildup on artery walls, leading to the brain. Osteoporosis. Having less estrogen after menopause causes you to lose bone mass much more quickly than you did before, which puts you at risk, which is a condition that causes your bones to become brittle, weak, and break easily. A recent large study found that women who have severe hot flashes and night sweats during the years around menopause usually have more bone loss and are at higher risk for hip fractures than women who do not have severe symptoms. Lead poisoning. Lead that you are exposed to over your lifetime gets stored in your bones. Because bone begins to break down much more quickly after menopause, that lead is more likely to be released into the blood, increasing your risk for high blood pressure, atherosclerosis, which is the hardening of the arteries, and kidney issues. Urinary incontinence. About half of postmenopausal women have trouble holding in their urine. Lower estrogen levels weaken the urethra, so consult your healthcare provider to learn about treatment options for incontinence. And last, oral issues. Dry mouth and an increased risk for cavities are more common after menopause. What can you do? Get plenty of exercise and physical activity. Eat a healthy diet. Quit smoking if you smoke. Try your best to manage your stress. And definitely know your numbers, blood pressure, body mass index, all of your cholesterol levels, and your blood glucose, known as your blood sugar. Some continuing issues. Some women develop endometriosis following menopause. Endometriosis is a condition in which the lining of the uterus, the endometrium, grows outside of the uterus, most commonly in the ovaries and fallopian tubes. Endometrial growth feeds on rising estrogen and may bleed and swell, leading to inflammation and scar tissue formation, triggering symptoms like pain, spotting between periods, and digestive problems. I want to make a note. Hormone replacement therapy, whether that be birth control or replacement therapy during menopause, contains estrogen. Therefore, women with endometriosis may want to speak with their healthcare provider before starting treatment. Uterine fibroids are mostly non-cancerous tumors that develop in the uterine wall. They may vary in size and number, and it is possible for women to have several fibroids and not experience any fibroid symptoms and not even know they exist. However, those who do experience discomfort generally report common symptoms of varying degrees, such as a feeling of pelvic pressure or fullness, heavy bleeding, frequent urination, constipation, lower back pain, and painful intercourse. Your healthcare provider may detect fibroids during an annual pelvic exam. So here are some ways to treat fibroids. Hormonal therapies. Birth control pills are one possible way to manage symptoms such as pain and excess bleeding. However, they won't shrink the fibroids or cause them to go away because this therapy contains estrogen and progesterone. Myomectomy. Sometimes the surgical procedure is performed to remove the fibroids without removing the uterus. And last, hysterectomy. For severe symptoms related to large recurring fibroids, a hysterectomy may be the best option, which is the full or partial removal of your reproductive organs. A full meaning the uterus, fallopian tubes, and ovaries. A partial may be just simply removing the uterus and leaving the tubes and ovaries intact. When the long-anticipated menopause symptoms finally appear, women may feel eager to undergo tests to confirm the transition. They are typically done after a woman has not experienced a period for at least a year and are about to enter postmenopause. At this stage, hormone levels stabilize, and women can take several blood tests for a menopause diagnosis. They can also have their vaginal pH checked to confirm their menopausal status. Besides a woman's age, clinical history, and lack of a period, there are several menopause tests that can be ordered to determine whether she indeed has reached menopause. A variety of conditions may cause menopause-like discomforts, including thyroid disorders. In some cases, healthcare providers may also confirm menopause merely on experienced symptoms, a woman's age, and the absence of periods without running any menopause tests. Menopause causes disruptive symptoms that adversely affect work experiences for many women. As a result, women may choose to reduce working hours or leave the workforce due to difficulty managing symptoms at work. With more than 1 million U.S. women experiencing menopause each year, the condition still remains a health concern that gets little to no attention, despite the fact that it will affect every woman at some point in her life. Workplaces can support women who may be experiencing menopause by offering flexible work arrangements, adjustable room temperatures, better ventilation, access to ice and/or fans, non-restrictive and breathable uniforms, and adequate access to restroom facilities. What should women know? Well, women should understand menopause and seek support, identify resources, and understand various regulatory guidelines. Even when women recognize symptoms, 70% are not comfortable discussing these at work, and it's not surprising that 67% report concerns about the impact on their mental health. So what has been accomplished? Historically, laws have been passed to protect various phases of women's productive life. However, there remains a gap as it relates to menopause protections. A relatively small percentage of workplaces in the U.S. offer company guidelines, support, or acceptance of menopause as a true health issue. At this time, advocacy is an important tool to affect change and can come in many forms, ranging from individual efforts to raise awareness about menopause, to labor unions advocating for the rights and well-being of female employees, to nonprofit groups that support change efforts. Take the time to align the steps you put in place with employees to ensure they understand that they are supported. Women are looking for education, support, and guidance. Unfortunately, 1 in 4 women consider quitting their jobs due to a variety of symptoms. It is time to shift the narrative and break down the stigma. Leaders should create a menopause-friendly workplace by adopting policies and practices that both acknowledge and support menopause. The goal for every employee should be to thrive and to perform at their peak. Studies have shown that addressing menopause symptoms in the workplace has the potential to improve absenteeism, employee retention, and productivity, while causing women to feel more positive about their employer. Evaluate how existing workplace policies can be leveraged to support persons with menopause and determine whether changes should be made or new policies adopted. Survey employees to understand what is needed and act on the feedback. Survey women in your organization to understand how people are feeling about menopause and the type of support they are interested in. Appoint a menopause champion or form a working group. Annually review healthcare plans to ensure the plans provide adequate and affordable coverage for menopause, to include support for hormone replacement therapy, physical therapy for pelvic floor issues, and access to specialists in menopausal care. In addition, ensure that all employees are aware of wellness offerings, EAP programming, and healthcare coverage available to support them if available. Provide access to cold water, restrooms with sanitary products, temperature control, and consider flexibility in terms of work breaks and scheduling. Dress code policy and options for hybrid work or remote work. Last, spread awareness throughout the organization by providing education on menopause and the support you offer in benefits communications, new hire materials, and annual enrollment communications. Provide education and training to management on menopause and offer suggestions for how they can be supportive to ensure an inclusive workplace culture in which employees feel supported and comfortable at work. Consider this. The cost to replace a woman who leaves your business is estimated to be 150% of their salary. During the menopause transition and afterwards, hormone changes can bring about a plethora of symptoms and can raise your risk for certain health problems such as cardiovascular disease and osteoporosis. So how do you stay healthy during and after menopause? You definitely want to choose to eat a healthy diet, get enough calcium and vitamin D to protect your bones, be physically active to help bone structure as well as reduce anxiety and stress. Do your best to maintain a healthy weight through regular exercise and physical activity and a healthy diet. And if possible, limit and or avoid alcohol and don't smoke. With nearly 20% of the workforce estimated to be affected by menopause in the coming years, it will be important to pay attention to how we support women by offering support, benefits, and resources, and most importantly, working to normalize menopause and reduce the stigma to help women stay healthy and productive. SummaCare resources. As always, we encourage an annual visit with your primary care provider. We offer condition and care management if you have a chronic condition or have complex needs. We offer telephonic health coaching for lifestyle behavior management. Through Plan Central with SummaCare, you have access to WebMD Health Manager, which gives you access to a ton of health and wellness education. As a SummaCare member, you have access to 24-hour nurse line. SummaCare nurses are available 24/7, 365 to answer any of your medical questions or needs. We offer Teledoc Health, which is a telemedicine feature while traveling or in need of minor medical issues or concerns. We do offer a smoking cessation program titled Quick Care, which is a telephonic coaching program that offers limited nicotine replacement therapy. And you have access to Husk Health and Wellness discounts, which gives you access to discounted health club memberships, nutrition programs, and educational resources. Please refer to your schedule of benefits to ensure that all of these resources are available to you as a SummaCare member. Thank you for your time and be well. Here are the resources that were used for the presentation. And last but not least, follow SummaCare on any of the below listed social media platforms.